it's Lena Ward. I am doing the sheep's heart dissection today. So I guess we're going to start by doing the outside anatomy of it. So this would be the ventral side, or in other words, the front. And then we've got coronary artery right going down in here. And then we've got the dorsal side on here, right back here, and we've got the inferior vena cava back here. You can kind of see it right there in that little hole. And then we've got more veins up in here. Got one right here, and right in there, and then right in here. Veins are thinner because they pump blood into the heart, whereas arteries pump blood away from the heart. So veins are a little thinner, while arteries would be thicker because they have to pump to the rest of the body. Right now you can kind of see this would be the right auricle right there, which also connects to the right atrium. Then we've got the left auricle right up here, which also somewhat connects to the left atrium. All right, so I think that covers. Oh, also we've got base is the top of the heart and apex, which is the bottom. All right, now we're gonna open, let's see. Oh yeah, I forgot to. This one is the aorta right up in here. We've got the pulmonary veins right in here, in there, and then the superior vena cava. All right, so we're gonna open up. All right, so we're gonna look. So since we opened it, they're kind of going to be mirror images of each other so I don't get confused. Okay, so inside we've got, this is all the right side and the left side. We've got 4 chambers. We've got the right ventricle down in here, right in this area. That's all the right ventricle, and then right above it would be the right atrium. Between those is a valve, and that would be the tricuspid valve, which is these little, let's see what I can use, these little thingies right here, this valve, which opens and closes it and helps prevent backflow of blood. See if we can open, oh yeah, then we can see a little better inside. There's the valve. Kind of see a little better inside of there. And you got that, or I guess the ventricle. You can see inside that chamber. And then we got that valve, which has the chordae tendineae, which are these little stringy things right here. Then we've got over on this side, the left ventricle, this whole little part, more chordae tendineae right there, which leads to the left atrium, right up in here, right inside there, left atrium. And this valve right here is the bicuspid valve, which is also referred to as the mitral valve. Let's see here. We've also got the interventricular septum right here, which separates the 2 ventricles. We've got the epicardium, which is the outside. Then we've got the myocardium, which is all this inside. And then the inside, which is a thinner material, is the endocardium. Alrighty, and then we've got 2 other valves that we have to cover. So the way I got this is a little weird. So anyways, basically this is the aorta right here. I kind of cut it a little jagged, but the other half of it is also right over here. But as you can see, the aorta leads into the left ventricle, and you can even see little pieces of that valve right in there. As I stick the stick in there, it's catching onto that valve, which is the semilunar valve. Yes, right in there. You can see it coming in. But this is the aorta, which I kind of cut it, but if you were to put them together, they would meet right in there. That's where the aorta is. And that leads into that valve right in there, which is also known as the aortic valve, right in there, that thingy. And then we've got the pulmonary vein, which is right in here, this baby. So I'm gonna try and gently show where it leads to when I stick it in here. Gently. Able to open it and actually see the light at the end of the tunnel. There we go. So as you can see, as I go, it leads to the right ventricle, which this one is the pulmonary heart valve. You can see it right there as I touch it when I go inside. Right in there, but you can see my stick coming out. So that's the pulmonary vein, which leads to the right ventricle right in there. And that valve inside there. And then we can also see some trabeculae on this one, right in there. But yeah, I think I kind of cut it a little funky so you couldn't really see it, but that's the left auricle, which is supposed to look kind of like an ear. I can see it. And then the right one. Or wait, yeah. The right one's right over here. Right there. Right auricle. But I think that covers the majority of it. Just kind of in here a bit. See if we put it back together. Up top here, we've got those pulmonary veins right up in there, and the aorta artery right there.